Hey guys, me Dr. G. I've been working with David Lyons quite closely, trying to develop the nutrition part of the program for the MS Fitness Challenge. And every rep is a step program. Every rep is a step, which is a very interesting concept. Okay, I've been putting off a lot of these videos, been waiting for the perfect time. Yeah, but I'm very busy. I'm doing some coaching. I'm training every day. Eating. We have 5 kids, so I don't have my doctor's regalia on. I got a sweatshirt. I'm headed to the gym, but I just want to touch base really quick. They're like, "Who is this Dr. Gerard guy? He's just a dentist." Is that true? Yeah, yes and no, it is. But let me explain a little bit where I'm coming from. Um, my background, my childhood was a little tough. I put myself through college, through the military, etc. I had always been studying medicine. That was my hobby as a child. Everybody was reading comic books and all that. I was reading medical journals. So I ended up going to the military, ended up being trained in field medic type work, going on to be dental lab technology. Came out of school, went to college, got my bachelor's degree, doing research and things the whole way through. Then I applied to medical dental school. The first 2 years of my dental education was with the dental school I went to was a school of dental medicine out of Buffalo. They're at that time they were ranked number 4 in the country as far as West. But what's most interesting is they didn't approach dentistry from a tooth carpenter avenue, right? They approached it from more a medical, dental, solid well-being. So everything we learned was all about dental pathology, oral pathology, health. So while in school, we had an option, or I did anyways. I sought like a PhD thesis, and I talked to administration to let me get these 30 mice. I studied diabetes in those mice, and it was very, very interesting. It opened my eyes to the mouth-body connection and how things like diabetes are connected to our mouth, connected to our general health. So I graduated from dental school, nearly, I'm on the top of my class. I went on to a residency out in Long Island, New York, and worked under a great doctor named James Shuba. Really taught all my medical. So I did a 2-year residency. The first year residency was just, basically dentistry and things like that and medicine. The second year residency was plunged way into medicine and surgery. I continued my research with the diabetes. I continued my surgical training, and moreover, I began to teach the medical residents, the dental residents, surgery, pathology, etc. So after that, I went into private practice on Upper East Side of Manhattan. We saw movie stars, etc., etc. But that wasn't fulfilling for me. So I went back to the hospital, and at that point, I was on staff at 3 different hospitals, doing everything from cancer removal to tooth removal to reconstructions, facial reconstructions. Then I went on to study more surgery. I did dental school kind of a second time, redid all my dissections. Really did it out of the Medical College of Georgia, which is a medical program. Learned my IV sedation, learned all my medical practices, my ACLS, and continued my surgical training. So now I was doing bone grafting, facial reconstructions. At the same time, I was taking children to the operating room, doing surgeries there. So you get to, always being in the hospital, always dealing with very, very sick patients. So you begin to get a grasp of the reality now. Fast forward, right? Multiple sclerosis diagnosis, had to stop my practice. The way I practice now is quite a bit different the way I learned. I don't do antibiotics unless absolutely necessary. No fluoride, no mouthwash, different perspective on mercury fillings. But more importantly, I look at the mouth-body connection and how everything we do in our mouth is the beginning of our alimentary canal. And so the beginning of our digestion, the beginning of our exposure to our bodies. So it's a very, very important starting place. So I call the mouth the window to the body. So this allowed me a unique opportunity to continue my learning. Well, multiple sclerosis definitely did, but taking coursework with functional medicine, became a certified Walls coach. I've lectured with Dr. Walls quite a few times. So I think I bring to the nutrition table quite a bit, especially dealing with multiple sclerosis. I have a unique insight, opinion, insights on dealing with multiple sclerosis through nutrition. And so I'm not really going to get stuck on perhaps which diet is best, but I am going to share with you how dietary nutrients will change your life. Along with David Lyons, doing the training, and Shauna Ferrigno. You guys all know Lou Ferrigno and the Incredible Hulk. So very, very, very excited. I'll keep you posted. We're going to start doing these things like maybe every few days. I'll jump in for 2 minutes, so this video will be a little longer. The next videos are going to be quite a bit shorter because I want to just give you like little 2-minute pieces, and we'll go from there. All right, hope you guys are having a great day. God bless. We'll talk soon.